We're looking at session 9, From Data to Impact, demonstrating the power of preventive legal advocacy through data collection and program evaluations. And I will note that we have touched briefly on data collection and evaluations throughout various sessions today. So I think there's a lot of interest in this session. I know I get contacted about this a lot. So I am very excited to introduce our two panelists for this session. We have Dr. Stef Sloan, professor and research and evaluation consultant at the University of Kansas. And then Dr. Alexandra Pimentel, who is the data advocacy manager with the data advocacy team at Casey Family Programs. And I will just note, I have had various opportunities to work with Stef and Alex on different projects and getting information from them, and they are truly both wonderful. So I am excited for everyone to hear from them today and to learn. And with that, I will turn it over to you all.
Awesome. I think I'm going to be getting us started today. So I'm going to just share my screen here. And I'm going to be talking about how I conduct evaluation and how I think we're starting to envision what evaluation should look like in this space moving forward. So I'm really going to be talking about the participatory evaluation approach, specifically for pre-petition and preventative legal services. I do this work both at the University of Kansas and also as an independent consultant. So I'm just going to talk a little bit about my experiences. Unfortunately, I know some people were hoping that we'd give like some data bites today. I will share some anecdotes from some projects that I work on, but really, I'm just kind of talking about the nitty-gritty nuts and bolts on how we do evaluation and why also the participatory action design. So participatory action is really just, it's engaging folks with lived expertise and those most impacted in the work. So we're really making sure that folks who are most impacted and folks with lived expertise are engaged from start to finish in the evaluation and in the research. We're also ensuring accountability for anti-racist evaluation design and facilitation. I'm not going to go into a lot of detail about what that means, but it's really just ensuring that we're thinking meaningfully about how different populations are impacted by the way that we shape data and by the way that we think about data. And then we also use a lot of different interactive data collection approaches. So I do a lot of visual participatory methods. Again, not going to go into a lot of detail about that today, but just to give you a little bit of information about what that means is we then end up with 3 different kinds of data. We end up with numerical, so quantitative data, qualitative data, which is that narrative, that story, and then we end up with some visual data, and then we can triangulate all 3 of those data types. And then we are, throughout the entire process, seeking and incorporating evaluation plan feedback from advisory boards, councils, individuals with lived expertise. So that's sort of the foundation that I base my evaluation work on. And so to kind of sum that up, we start at the bottom with this participatory action design, and that's the framework, that's the foundation. And then we move on to framing the need, understanding what data story we need to tell. What is it that we need to help convey about the programmatic impact, about the outcomes? And then we're going to determine, okay, what are we going to specifically measure? What are we going to identify as those measured variables? And then we're going to shape all that together and use data to tell a story. So framing the need, we're really looking at a couple of different levels, and I love the ecological systems level, that Bronfenbrenner stuff. I don't know if you're all familiar with that, but it's really the idea of, we're understanding the individual impact. So children, families, parents, family systems, and then we're looking more broadly and thinking, what is the community level impact? And then we're also thinking about broadly the systemic impact. And when I'm doing that, when I'm trying to set the stage, I'm really looking at what is some publicly available data I can lean upon. So I can look at child welfare data, I can use census data, I can use other kinds of county statistics that are publicly reported. And I'm just using that information to say, okay, what's the problem here? What's going on? What is it that I really need to articulate so that we can truly substantiate the need and the utility of these programs? And so then I'm asking, who is the program serving and how? I'm looking at those demographics, numbers served, types of case actions and resolutions, the types of agency programs. So an agency doesn't implement something in a bubble. you're doing a lot of different things. How can we collectively measure all of the different things that you're doing, all of the ingredients that are going into the work that you do, because it's all shaping the impact. And then, what is your unique agency approach? So when I am engaging in a new evaluation project, these are the things that I'm starting to look at. These are the beginning pieces that I'm trying to put together. Just to give you one example of how I've done this, I'm working with an organization in California that's working on a preventative housing program. So they're really focusing on domestic violence victims and doing legal advocacy and helping ensure stable housing for domestic violence victims. And we went in and we talked a lot about like, what are some of the other data sources that can help us articulate that story? And we looked at the child welfare data, we looked at the housing data, we looked at domestic violence victim impact data, and we really tried to kind of collectively tell a community story, which is, why do we need to fund this work? What is the community truly in need of? And what gap are we filling? And so I kind of layer that onto the participatory approach. And next, I'm really thinking broadly about my outcomes. And this is when we're thinking about outcomes, there are so many different directions that we could go. I think when I work with folks doing, really putting forth the legal advocacy work, doing the preventative and pre-petition legal services, I think one of the biggest challenges we're running up against is, how do we figure out what to measure? There are so many different directions we can go. And so we really have to drill down and decide what are we really trying to tell the community? What are we trying to tell our funders? What story is it that we really want to tell? What change will be made as a result of our actions? So we're looking at those case specific outcomes. We're looking at reunifications. We're looking at prevention of foster care removals. We're looking at kinship placements. And then we're also looking at more upstream stuff too, like maltreatment prevention, permanency and stability, child and family well-being. We're also looking at other kinds of like community scaffolding, like access to justice more broadly, those referral agency partnerships, which are so important. We're also looking at things like perceptions about access to justice in the community. We're looking at all of those upstream measures as well. And then I'm putting it all together. So we layer this participatory approach and participatory data collection along with our community and program data, and we layer that on along with our outcomes data. And that's how we bring it all together and tell our impact story. I want to talk a little bit about that participatory data piece. So one method that I use is called ripple effects mapping. So what I'm doing is I'm getting together a very strategically sampled focus group. I'm bringing in folks with lived expertise with various perspectives. I'm bringing in folks who are doing legal advocacy, doing the legal work. I'm bringing in folks from the community, from referral agencies. And then we're also bringing in, if we can get them, we're bringing in folks from the judicial system. We're bringing in child welfare folks. We're trying to bring a collective and strategic sampling of divergent thought. And we all come together and we do a focus group. And as we do that focus group, I'm visually mapping what they are talking about. And what we're doing is we're putting together a story. We can't always measure what happens in the future. We don't always know what happens to folks, right? But when we can ask people and bring them all together into this convergent thought, then we can really better understand, what is happening 10 years down the line? What is happening as a result of the work that we're doing that prevented an adverse outcome? It's hard to measure prevention because you're measuring something that never happened. So this is just one way of being able to do that work. So just to kind of put this back all together, I love myself a good visual aid. I'm layering that participatory action design. I'm saying we need to engage with folks with lived expertise. They need to drive the boat. We're also framing the need. We're asking, what's the community specific need and who is the program serving and how? Then we're determining those outcomes. What specifically are we going to measure? And what I love also about participatory design is we don't have to know all of those things in advance. We don't know what we don't know. So when we're engaging folks with lived expertise in that participatory design, they're also letting us know throughout the course of the evaluation other things that we need to measure and understand. So that's really the determining of the outcomes, what change will be made as a result of our actions. And then finally, we're putting it all together and we're telling that data story because we really need to be able to demonstrate our impact. We need to understand strengths and weaknesses of our program and where where we have resource gaps, where we need to fill those gaps. We also want to look at it from the individual, community, and the systems level because that really helps us appeal to a broad variety of funders. I know we've had a lot of conversations today about different types of funding and all of that. And what I really love doing about with evaluation specifically for these types of programs is helping justify the need. And the more evaluation and the better we can tell that data story, the more we can continue to justify and implement and then hopefully institutionalize the use of public funding for these types of programs. And then other kinds of considerations. So these are all just these are things that people say a lot when we talk about evaluation. And I just want to kind of make a note that we can't always make statistical correlations. And that doesn't mean that we can't connect the dots in a very meaningful way and in a way that's both valid and reliable. So we may not serve enough people in our community to generalize and to generate statistical significance. I know when I work with folks in rural settings, getting those numbers to be able to make, to conduct generalizable statistics, we don't always have that privilege, but we can still conduct evaluations in a way that allows us to collect the dots. And that's really through that triangulation of data piece. We don't also have to collect every possible outcome measure to identify impact. I really love using qualitative data to help tell the story of how those quantitative variables come together. And so we may not know where we're landing just yet, but we can use quantitative and qualitative data to talk more about where we're going and talk about some emergent findings that we have. And then, of course, you don't have to sacrifice confidentiality for evaluation. So this is a big one that I get is we can't really do that because we don't want to sacrifice confidentiality. But the best news ever is I do a lot of work with de-identified data. And I'm able to work really successfully with legal partners to help them find approaches and methods for de-identifying that data and then getting me the data that doesn't have any personal information. And then also for my focus groups, I allow for anonymous engagement. I just recently conducted a couple of focus groups with domestic violence victims that were currently fleeing their abusers. And so they were able to participate anonymously. I was able to partner with their caseworker, with the organization that was providing supportive holistic services. And I was able to get their incentive through the case manager to the individual. And I didn't need any identifying information. And they were able to participate and talk about their stories without sacrificing their identities or their safety. And finally, funding evaluation. This is always kind of a huge crux, is where do we get the money to fund evaluation when all of the money that we have really needs to be going to funding the program? And how do we allocate unique funding specifically for evaluation? It's tough. Some grants do provide provisions and earmarked funds specifically for evaluation. There are also other kinds of grants that only fund evaluation. But also, Alex and I had several conversations about this. You don't know where to start? That's okay. Reach out to us because either one of us, we're both extremely passionate about helping connect all of these dots across the board. Another thing that I always suggest is start small and build up your evaluation plan each year. So year one, you might just be tracking one outcome measure. You might be looking at how many foster care removals did I avoid this year? And that's not always an easy or concrete objective. So you might even start smaller than that and say, how many people did we serve this year? How many individuals received our supportive services? And that's one place that you can start, and you can grow from there each year. We can also be strategic about the use of funding. I have worked significantly with using child maltreatment prevention funds. So specifically, it's a captive funds, but it's called CBCAP. That's the portfolio, and it's community-based child maltreatment prevention funds. And I've had a lot of success in Kansas with directing captive funds towards the more upstream preventative legal services so that in Kansas, we can reserve those Title IV-E funds for the pre-petition work. And so just thinking strategically about the use of funding. Also, another thing I really love doing is writing grants that can help supplement and provide some data infrastructure support, because that's cost intensive, it's time intensive. So how can we be really strategic about writing grants for evaluation that can also augment some of those just general operational costs? And then finally, just gonna put this out there, if you are ever like, I would love to be able to have a more robust evaluation of our program, but I don't know where to start, reach out. There are so many opportunities to write larger scale grants that would allow for multi-site evaluation. So there's so many opportunities to collaborate together as an industry and be able to, pool all of our resources and then maybe be able to implement a broader scale, a wider scale evaluation across all of our smaller programs so that you alone as one agency don't have to shoulder the brunt of the costs of evaluation or the, just resources and time and intensity of conducting an evaluation. So this is really just kind of my broad scale overview of how I conduct evaluations, how we do it, the basic theoretical principles. I think, there are so many opportunities to delve into, more specific topics, like what are some of the findings that are coming out of these programs? What are some of the opportunities for using strategic participatory methods to get really good data at a really low cost? How is it that we can do this collectively and pool resources to do it well? There are so many opportunities. I'm going to pitch it over to Alex at KC Family Programs. But I will send this out. Here's my contact information. Again, I'm always happy to answer questions. I'm happy to help. I'm happy to write grants, along with folks if there are any collaboration interests.
Thanks, Steph. Let me pull up my portion of the presentation here. All right, can folks see my screen? It says, yeah, there we go. Let me know if there's any issues hearing me or seeing this information. So I want to do a deep dive into one aspect of what Steph discussed in the prior presentation, and that is really this framing the need piece. So who is the program serving and how from a quantitative standpoint? And as Steph said, I'm not going to be sharing any particular data here today. I'm really going to be sharing a framework, and a lot of this is based off of the work that I've done in KC Family Programs to provide some technical assistance for preventative legal advocacy programs and other legal advocacy programs to think about how to collect data in an effective way. And so I should also do a shout out to the First Clinic, which was the very first legal advocacy project that I worked with and really provided a really good grounding for thinking through all of the different ways of collecting data and doing some excellent work with the data that's being collected. So thinking about why to collect additional data, obviously the first thing that comes to mind is program evaluation. That is the topic of the presentation, but also it's not just that. So if you're collecting data, you can use it and you should use it in as many ways as are viable options to use it. So you can use it for program evaluation, you can use it for demonstration and spread, so other folks can model their programs off of the work that you're doing, also to acquire additional funding. But even before you've done program evaluation, you can use the evidence in the data that you're collecting to demonstrate the need for additional funding. So for example, if you're having referrals come in and you don't have enough capacity to admit everyone who's being referred to your program, and you've documented that, you can say there are 100 referrals coming in. We only had capacity to accept 50 folks into our program. That is demonstrating that there's an unmet need and you haven't done program evaluation yet, but you have demonstrated there's a need that could be supported by additional funding. The other thing I'll say about using this data is you can always use this kind of data for internal CQI, so internal continuous quality improvement. And what I mean here is you can look at your data for yourself, not data that you're reporting out on, but you can look at the data and start to see things such as, we have many people being referred from this referral source who aren't meeting the qualifications to be admitted to our program. Is there anything we can do to work with the folks who are referring out of that referral source to understand what the qualifications for the program are? Or maybe you're trying to provide services and you provide services across many counties, but there's one county where you're seeing that it's way harder to get services for folks who are in need of substance use disorder treatments, for example. So if you can use data that you're going to use for program evaluation for all these other really beneficial things as well. And I'll put that in as a plug for why the data should be collected, not just for program evaluation. Now let's see if I can switch slides here. Here we go. So there's three areas of data collection that I'm going to touch on today. And the data measures you collect are going to vary across these three areas based on the type of program that you have and that you're developing. But in general, your data measures should hit on some aspects of these three areas. First, client information, and you probably are already collecting this or going to collect this just when you do an intake to some degree. Services provided by your program. We'll talk a little bit more about what that can look like. And then outcomes. And outcomes are the trickiest because outcomes, you can identify a perfect outcome and then not be able to identify a good way of collecting the data to capture that outcome. So we'll talk a little more about that as well. So for client information, this information, you're probably already collecting things like age, gender, maybe even race and ethnicity demographics. The one thing I'll say about race and ethnicity information is that it's very helpful if the categories that you're collecting are in line with your agencies or the child welfare systems that you're operating within, the categories that they use, because then you can compare your clients and their demographics to the child welfare system's demographics as well. One thing I will highlight is that child demographic information is often not the same in terms of race and ethnicity categories as client demographic information. So those, you shouldn't consider parent or guardian racial or ethnic demographics to necessarily be matching child demographics. They should be collected separately. And then the last thing for client information are client needs. So it is very helpful if you're trying to demonstrate the effectiveness of the work of social workers or parent advocates to be able to say 80%, for example, 80% of clients who were accepted into this program had housing insecurity, and we were able to connect them with housing resources 90% of the time. So it's useful to collect what the needs are often during intakes. So the second scope that your data collection should cover are the services that you're providing. So these can be a variety of things, and you probably are going to be collecting some of these already, but some things you may not consider are if you provide information or resources or referrals during an intake, even for clients that aren't accepted into your program, that is work that has been done that is helping people, and it should be documented because it's important work that is really helpful, even if it's just a 20-minute phone call and you evaluate that the person has needs that can't be met by your organization, but you give them a referral to someone who can help them. That could be incredibly beneficial, and it's definitely something that should be tracked. Then any work that parent advocates are doing, any work that anyone is doing that is beneficial to the clients should be tracked in some way. For parent advocate work, it could be the number of meetings or the amount of time spent with a client. And then any referrals or assistance in acquiring services should be documented, and the particular help that was given. Was it acquiring housing vouchers? Was it getting enrolled in a substance use treatment plan or facility? That should be documented specifically what the service was that goes with the case. And then lastly, the legal work should also be documented. So that could be letters, calls made, case court dates. This is probably the part that folks will already be collecting or thinking about how to collect. And then last, but definitely not least, because this is the trickiest, are outcomes. So when we're thinking about outcomes, it would be awesome if we could have, when you're running a program, it would be awesome if you could have access to everyone's data. But this is, and in some cases you might, in many cases that's not the reality of the situation. So the outcomes that you are going to want to track are probably going to vary based on just what you have access to. So maybe you have access to external data sources, maybe you have access to the court data in your jurisdiction, maybe you have access to the child welfare data. If you do, that's awesome. That's phenomenal. And you should definitely be able to look at what they have and incorporate that in. It's very likely that you are going to have to look at outcomes within your own program if you're just trying to collect quantitative data on outcomes. And so depending on the scope of who your client or who your program serves and admits into the program, these could be different things. So maybe it's investigation occurrence. If you're doing preventive legal advocacy, did an investigation occur? What was the result of the investigation? Whether or not a dependency was filed, if you are working with parents who've had removals take place or guardians who've had removals take place, whether or not reunification was achieved. And another thing you can look at are more of the qualitative measures, but things like client satisfaction. And this would probably involve a survey, maybe after the case was closed or at case closure, but other things you can think of that perhaps aren't typical outcomes that you'd be looking at. And so I have a few slides here just thinking about the logistics of data collection in preventative legal advocacy programs. So things like, when should you start doing data collection? And of course, the best point to start data collection is you've thought all this out very thoroughly before you've even launched your program, and you have a beautiful data tracking software and everyone's trained on it, and that's awesome and probably fairly unlikely. So the best time to start data collection is when the program is initiated. But also you can start data collection at any point as you're starting to think about how are we going to do some program evaluation. And then the last point is, even if you were to do all the thinking and planning before your program got started, data collection really shouldn't be like this static one-time thing. It should be a process where as you go along, you start to notice, oh, this is something that's popping up a lot that we should track for our clients, and we should change the way we're collecting data to be able to do that. So it should definitely be something that's dynamic, that you return to, and that you can start collecting data measures a year in, 2 years in. You can start collecting data measures whenever that you think would be beneficial to track. So what I just talked about was over the course, the life cycle of a program, when would be good to start collecting data. But then there's also the question of what data should you collect at what points during the course of a case. So there are potential data collection opportunities that occur across the different stages of a case. And the very first one is at referral. And maybe you have a referral form that people use, and you could add fields onto it of metrics that you want to collect. Or maybe referrals are very informal, and there isn't like a good opportunity to collect a lot of client information at referral. But potentially you could collect client information at referral. So things like the demographic information, client need information that we were just discussing. And then the second big point where there's an opportunity to collect data is during intake. And this really is the point where it is best to collect client demographic information. So gender, age, race, that kind of thing, as well as client need information. This is a good opportunity to collect client information about client needs, although those could also come up throughout. And then as we're moving along, once someone has been accepted into the program and services are being provided, it's good to document those at the time that they occur. Not essential, but it is good just so you don't miss anything. Like if someone had housing insecurity, you want to be able to track whether or not you were able to provide them with resources that were helpful, and you might miss just entering in that information if you wait too long. And then There's another opportunity to collect data at case closure. Here, we might be able to collect some outcome data, what the resolution was of the case. Maybe client satisfaction information could be collected at this point. And this is also a point at case closure where you can go back and say, were there any services that were provided that didn't get entered earlier on, and just do a double check of the data. And then lastly, we have after case closure, which allows for outcomes to be looked at that are longitudinal. Maybe you can collect data 6 months after the case closure. This also allows for you could conduct a survey after case closure at a certain point to collect client satisfaction information. So there's definitely opportunities after the case has been closed to still collect some of that outcome data, but this would not be the point to start collecting data like, for example, client demographic information. All right, and then another important aspect is who should be collecting the data. And my main thought here is that it is very useful to, unless you have administrative folks whose entire jobs it is to enter your data for you, in which case that's phenomenal. But in most cases, it's very useful to have different aspects of data tracking be assigned to the folks who are most involved in the work that you're trying to track. So for example, for whoever's doing the intake forms, if that's where you're collecting client information, whoever's collecting the intake form should be the person in charge of the client information data. Whoever is connecting folks with resources once they're in your program, those are the people that should be entering in the service data. And yeah, so there are just some examples here on the slide, and then attorneys can document the legal services provided. Again, some of this may differ depending on the structure of your program, but the main point is to not have folks who aren't involved in the work have to be documenting the work, because then you're going to run into really low data entry because people don't have to do an extra step to know the information that they need to be inputting into their data tracker. And then I have one more slide, and then we can wrap up for questions. And these are just some tips for effective data collection. So the best data collection is not you've hired a statistician to identify the very best measures you should collect. The best data collection is data collection that is feasible and realistic, where you can reliably collect the majority of data consistently and accurately for the measures that you've identified. And it doesn't take folks an hour to get the answer to input one value into your spreadsheet. So it has to be something you can collect in a timely way as well. And then some tips about data collections and trackers. It's best to minimize the amount of data duplication so that people aren't entering in the same information multiple times. There's often some automated processes where your intake form, for example, could drop data into your data collection tracker for data evaluation or for program evaluation. And then using technology platforms that the team is already familiar with is better than buying a really fancy software that you have to do very extensive training on. So Excel, if you use Excel is the platform you should use to track data. If you use Google Sheets is the platform you should use to track data. And then if there's a platform that people have access to that allows multiple people to edit simultaneously, that's great, but it's probably preferable just to use the platform that everyone's familiar with and can actually enter data into. And so with that, I am done presenting, and I think we might have time for some questions.
Sorry for the lag there, guys. All right. That was excellent information. Sorry, some difficulties on sound over here. That was excellent information. Thank you both so much. There was like so much to be gleaned from that. I feel like it was a bit overwhelming, but can't thank you enough. I want to run through, so we do have a couple of questions / comments that I just wanted to run by you. And the first one, I'm not sure if you guys will have insights on this, but let me know if you do. Valerie was noting that she was interested in hearing from any of the PLAs that are receiving 4E funding and how the metrics, and I think this is while Stef was providing their presentation, she was wondering if you had any insights on how those metrics connect to the Children's Bureau reporting requirements. Thoughts on that?
Yeah,
Stef?
well, yes. And so the requirements are generally they're outlined upfront, so you know in advance what you need to be reporting to them when you have that grant. So one helpful thing about that is you can kind of structure that as like, this is the baseline data we'll collect, and then we'll identify things outside of that that we will also collect. Another part of that is I just cannot say enough about having a good system for making sure that you're collecting and sort of having a more polished final like version of all of that data by like for each quarter, and then it also at end of year, because it is really time consuming to type all of that up. And like some of the, especially like federal child welfare grants, the reporting requirements can be really overwhelming and extensive and exhaustive. So having as much of that kind of built into your system as possible allows for you to just kind of lift those numbers and plop them into the template that they provide, because they always provide a template. And so you have kind of like an outline, a structure of what you need to be reporting. If there are any other additional kinds of metrics that they want you to report, I know that there was a comment specifically about those measurements of success. So sometimes grants are really specific and also well-intentioned, but unfortunately defining how success is measured. And so one thing that I have learned is that we can always do magical things with data. So how many foster care removals did we prevent? We don't always have those numbers in the time frame that a grant reporting cycle might be occurring within. And so those numbers could look extremely low, but there are always opportunities within those grant reporting structures to also define success in a different way, explain why you're defining it in a different way, and explain what the findings were related to that measure of success. Because I totally agree that a lot of these success measures are, I mean, that would be great pie in the sky, but these programs operate on a lot of micro efforts. And measuring the macro long-term effort is great, but it doesn't actually get at all of the work that your organization is probably doing. And so what I like to do to kind of scaffold that is within the structure that they provide for those grant reportings, I like to also identify how we define and measure success within our program, within our state, within our whatever. And and explain any sort of findings that may or may not look great on paper. And we run into this more often than not with our rural sites, where it's like, we served 2 people this quarter. And that sounds really womp womp, but we can also explain that we didn't just serve 2 people that quarter. We had these 2 very complicated cases. And here are all of the little micro movements that we took all across the life cycle of that case. So really, the outcome measure isn't served 2 people. The outcome measure is, did all of these small actions that led up to a larger outcome at the end.
That was an excellent response, Steph. Thank you. I think that concludes in our questions. Alex, do you have any closing thoughts on those items or anything else on the topic?
No, I think that was a great response. And you can track those things if you only have 2 clients that were served, for example, in a variety of ways. Some of those could be qualitative, some of those could be quantitative. But if you already are tracking them quantitatively, that would be an excellent place to include things like, what needs did the client have, and then what are all the little actions, or not so little, but like what was a series of actions that was taken to provide that client with resources and to provide assistance to that client.
Awesome.
And one thing, I'm sorry, I just have to add to that. One thing I love about the qualitative method of ripple effects mapping is it kind of gets at that like longitudinal, what we're actually trying to accomplish, but in a qualitative manner, because we're able to say we have those 2 individuals that were served, and we're seeing them 6 months in this focus group after their case is closed. We can actually talk about and explicitly ask about all of those child and family well-being measures. We can ask about them qualitatively and say, as a result of, all of these things that your lawyer were able to do for you. As a result of that, your child missed fewer days of school. As a result of that, like we can really dig in a qualitative manner into all of these other well-being measures and really start to connect those dots across the board. We can also look into things like reducing court burden and providing education through advocacy. Like all of those things matter. And so one of the things that I love doing with clients more than anything is sitting down at the beginning and saying, let's figure out all of the things that you do. We can't necessarily measure every single one of them, but they're all going to count somehow. We need to find a way to make sure that they're all going into your impact story. And it is so shocking how many times people are like, I didn't realize I was doing all of these things. And I didn't realize that this one little thing is actually a big thing. I didn't realize that that was such an integral piece of the puzzle. And that without those small things that we do, we can't do the bigger things. And so measuring the micro movements can be so important.
I was on mute again. Sorry. I was saying thank you both so much again for the wonderful information and everything that you've provided people today. It's been excellent. And with that, we are ready to close out for the day. I am blown away, like the presenters, everything that everyone has done to contribute to this has just been incredible. And, you know, I sincerely appreciate all of the efforts. Vivek had to sign off, but I know he sends his regards. He too was blown away by the response to the summit and to the participation. You guys have been active throughout the day and the feedback seems good. So this has really been wonderful. So thank you to everybody who attended, who took time out of your day to learn. I hope it was informative. I hope that you all feel empowered and motivated after today's sessions. I hope that you all, you know, viewing this now and at a later time are motivated to continue the good work you're doing or to get started in this space. There really is so much amazing work happening in the preventive legal advocacy and pre-petition space. There's a lot of opportunity here, and it was really my honor to get to host this and spend the day showing off all the great work that's going on around the country. One last plug, if you are interested in learning more about the topics we've covered today or preventive legal advocacy generally, please reach out to me. Let's connect and let me see how I can help support your efforts and what I can do to support your work. Last thing before I sign off, I would be remiss if I did not say a very big thank you to my wonderful significant other who you all don't realize has been sitting in the room next to me all day. I have selfishly put all of his production skills to work for myself today to look good on camera and to help manage the slide transitions and everything else. So I really appreciate that effort. And if you ever need webinar support and are looking for someone, let me know because I know a guy and we can get you set up. But thank you, everyone. I hope everybody has an amazing holiday season and I look forward to working with you in the new year.